name is Salvador Forte. I'm an orthopedic surgeon specializing in adult hip and knee reconstruction. One of the more common conditions that I see is osteoarthritis that affects the hip and knee, and it can be quite debilitating, leading to severe pain and affecting patients' ability to do the things that they love. I also evaluate patients with pre-existing painful total hip or total knee replacements that are there, and I do a full diagnosis and discuss treatment options and basically anything that we can do to help alleviate patients' pain. I'm originally from Queens, New York, and I had an injury to my ankle that required surgery, and I saw my ability to recover. And so from that point on, I looked into orthopedics, and pretty early on, I realized or discovered hip and knee replacements and how you can master a procedure and provide a significant effect to a patient's life. And so after my injury and being a patient, I saw my recovery. It was a little bit of a different ailment, but I was able to see the effect that arthroplasty had on patients' well-being. So I am very fortunate. I had the privilege of doing my orthopedic surgical training in Philadelphia, which is a powerhouse for orthopedic care. And we had a consortium model where we worked with multiple different hospital systems in Philadelphia. And so I was able to learn from the best for minimally invasive procedures all the way up to the most complex. I also had the unique privilege of going down to Baltimore, doing or specializing in complex reconstruction. And then my last year in training was in New York, in Long Island, at North Shore University Hospital, which is the #1 hospital in Long Island. And there's where I really honed my craft on minimally invasive surgery, multimodal pain regimens, and short stay total hip and knee replacements, meaning that the patients are going home the same day, and if not the same day, the following day. And so that has been, I have been very fortunate in getting the full spectrum of care or ability to take care of patients from A to Z. The biggest pillar in my practice is patient education. I think a well-informed patient regarding their diagnosis and their specific treatment options is by far the most important aspect of the way I provide orthopedic care. I think a well-informed patient is going to make the best decision for themselves, and I am here to help them make that decision by exploring the different options that they have and really to gain a certain level of understanding of what ailments they have. And to be honest, maybe cliche, but I do treat my patients as if they're my family. I think if I can explain something to my family member, they have specific questions, and if I can put it in those terms, patients appreciate it and they're more well informed. And so far, it's proven to be very effective, and patients appreciate it. And I think they're the happiest patients out there. Especially since it's a personalized plan for them. And again, this is not just surgical patients. A lot of my patients, we go through non-operative or conservative routes, and my goal is just to get them back on their feet, restore function, and give them a pain-free life as best as I can. I love what I do. I think the biggest part of it is restoring patients' function, and just whether that's an injection, physical therapy, or surgery, it's making sure that whatever the patient decides to move forward with, that we give them the best outcome. And now that is the main reason why I think most people go into medicine. It's definitely the reason why I decided to go into medicine, and I am just very fortunate to be in this field. When it does come to a hip or knee replacement, or a redo or a revision of a hip or knee replacement, I have extensive training in being able to tackle those surgeries, kind of provide that for patients and have them up on their feet and recover relatively quickly. It's amazing. It's a privilege, definitely. The biggest thing for me is spending time with my family as much as possible. I'm relatively new to the area, and I absolutely enjoy everything that Florida and Palm Beach County has to offer. And so I spend as much time with my family exploring the outdoors as much as possible. Other than that, I do weightlifting and just explore different types of movies, read a lot of books, and I think I'm pretty normal. I have just started picking up golf, but I'm pretty bad. I think I'm realizing how difficult it is, and that's something that me and my patients will talk about, and I try to get as many tips and tricks from them as possible, but it's proving very difficult. So one of the big things is how I do hip or knee replacements when it comes to it. So for knee replacements, I do partial knee replacements and total knee replacements, and I do use a robot to do the surgery. I think it allows for a more personalized surgical option. I do the surgery, the robot doesn't do the surgery, but what the robot does provide is an ability to place the components in a position that I want, that's very accurate. And all in all, it leads to less surgical releases, less surgical dissection, and ideally a quicker recovery, especially on patients who undergo a partial knee replacement. And now all of this is something that I would discuss with the patient to see if that is an option for them, because patients who do the best for these surgeries are those that have the appropriate indications and who I know will be set up for success after the procedure, because that's the whole point of doing the surgical procedure. Regarding total hip replacements, I do the direct anterior approach through a bikini style incision or a transverse incision. It's a incision based on the anterior part of the skin creases of the hip. Technically, it's harder to do, but it leads to improved scar appearance and better incision healing, which is paramount when you're doing a surgery. I do think that it's worth it to do it this way, and I believe I'm the first to do it in this area. And also I am the first to use hip artificial intelligence navigation. Now, this is an enabling technology that allows me to do a total hip replacement with fluoroscopy or x-ray, which I do at baseline. And this allows me to place components exactly where I'd like to place them. But the artificial intelligence navigation gives me real-time live intraoperative feedback and measurements. So I know exactly how I'm putting these components in. And really it's all to avoid surprises. I don't like any surprises, and I like to leave the operating room knowing exactly where I place these things, and patients appreciate it too. The biggest thing that brought me down here was the opportunity to affect a large volume of patients. Now, in my practice, me just being the surgeon, it really takes a village for this to be successful. And so I have to give credit to our incredible team. It is all about the team, and that comes down to the office staff, the surgical coordinators, and the surgical OR staff. And they truly allow us to fire on all cylinders, because all of the work is done before the surgery, and they are the ones that keep everything in track and in line and allow us to prepare effectively. Now, and that really is a testament to just everyone and every single team member. I think the culture is very clear. It's very palpable when any patient is seen and then has to go through surgery. They've had a pleasant experience at every point of care, and that is paramount to just having a great overall experience and great outcomes.